Hello, I am Dr. Rajiv. Welcome to my channel YouTube General Medical Knowledge. Today I shall discuss a general medical topic, that is white hair treatment facts and myths. सफेद बाल के इलाज की सच्चाई. Healthy hair is a sign of good well-being and youth. The exact function of hair in humans is not clear as of now, but it has a great social and cosmetic value and is a means of silent communication too. Hair color and style can define the physical appearance of a person and thus has an impact on his body image. In society, the graying of hair is wrongly perceived as a sign of old age and senility. Medically, it is known as CANITIES or ACHROMOTRICHia. It may have a negative impact on the self-esteem and confidence of a person. It could be caused by some genetic and psychological factors or due to an underlying health disorder. Age-related graying of hair is a part of the normal aging process. Overall, up to 50% of people become partly grey-haired by the age of 50. Sometimes there is a premature graying of hair. That means graying of hair comes before its normal timeline. According to skin specialists, graying of hair is called premature if it appears for the first time before the age of 20 in the fair-skinned people, before the age of 25 in the white-skinned people, or before 30 in black-skinned people. It needs attention if graying starts in the 20s or 30s. Signs of white hairs. Hair color is a unique feature in humans, ranging from black, brown, and blonde to red. The color of human hair is due to a pigment known as melanin produced by the melanocytes present in the hair root cells or follicles. Vitamin A, C, and B12 are the most needed vitamins to increase the melanin production in your hair. As the hair is formed, melanocytes inject melanin into cells containing keratin. Keratin is a protein that forms our hair, skin, and nails. Throughout the life years, melanocytes continue to inject pigment into the hair's keratin, giving it a colorful hue. With age, the melanin production in hair roots decreases gradually and ultimately stops. The hair thus turns grey and eventually becomes white. The hair root cells have a melanogenic clock that slows down or stops melanocyte activity with each year of your life passing by, thus decreasing the amount of melanin our hair receives, leading to graying or whitening. What causes premature whitening of hair? There are 8 probable causes of graying or whitening of human hair. These are dietary deficiencies, genetic factors, environmental pollution, smoking, psychological factors, thyroid disease, race and heredity, and medications. A deficiency of vitamin B12, zinc, vitamin C, and copper may cause an early appearance of grey hair. Because these nutrients support the metabolic processes involved in giving hair its natural color. One of the most common reasons of having grey hair is your genes. In such cases, it is extremely difficult to do anything for it. Excessive and prolonged exposure of environmental pollution makes our hair threads weak. With time, this also may lead to graying of hair. Like pollution, smoking causes free radical formation in our body. These free radicals produce oxidative injury to melanin producing cells or melanocytes, leading to the depletion of melanin pigment in hair root follicles, which promotes early graying of hair. Stress and anxiety also are involved in premature graying of hair. It is normal to experience stress from time to time. It is important to identify The symptoms of chronic stress, such as feeling low, a sudden change in appetite or mood, fluctuating high blood pressure, and abnormal sleep patterns. Stress causes oversynthesis of a substance known as noradrenaline due to overactivation of the sympathetic nervous system. High noradrenaline levels cause suppression of the melanin producing cells in hair roots, leading to less or no melanin and graying. People who suffer from thyroid diseases tend to have gray hair earlier. Thyroid disorders like hyperthyroidism or hypothyroidism means either more production of thyroid hormone or less production of thyroid hormone can cause hormonal imbalances in the body and may result in premature graying or whitening of our hair. Abnormal levels of thyroid hormones affect melanin production in hair roots. Consider having a thyroid profile to know if your thyroid hormone levels are within the normal range and act accordingly with the help of a skin specialist. On an average, white people start to gray in their mid 30s, Asians in their late 30s, and African Americans usually say hair color changes in their mid 40s. Premature graying of hair has been seen with a higher frequency among certain families, suggesting a hereditary and genetic cause for this condition. Certain cancer and anti-malaria drugs can cause early hair graying also. Till date, the exact cause of graying remains incompletely understood. Premature whitening of hair can occur as an autosomal dominant primary disease also. Graying can also occur in premature aging disorders like progeria and pangeria. Association with allergic and autoimmune diseases has also been seen related to graying of hairs. Treatment and research on graying of hairs. There is no single widely recognized standard evaluating system to determine the severity of graying. Graying is generally classified as mild, moderate, or severe based on the percentage of hair involved, the number of hairs involved, and the percentage of hair affected in different areas of the scalp or our head. Although many patients attend skin specialists for the treatment of this problem, but very few treatment options are satisfactory. The treatment of graying should be directed to address its cause. Vitamin deficiencies and thyroid problems may be reversed with vitamin and hormone treatment respectively. Plucking of grey hair is a no-cost option for individuals with less than 10% affected scalp hairs. Most persons have to rely on hair colorants or dyes for restoring their hair color. Hair colorants are prepared either from herbal products or are synthesized artificially. The advantage of herbal hair dyes is that they are less allergenic and less toxic. Synthetic hair dyes are most popular in the commercial market because their effects are longer lasting, but they carry a risk of damage to the hair shaft due to oxidation from chemicals. Herbal hair dyes do not penetrate the cuticle and get washed out with shampooing. Skin irritation and hair falls are observed risks after their use. Although the various vitamins and minerals such as biotin, calcium pantothenate, zinc, copper, and selenium are being prescribed, the results have not been promising. Calcium pantothenate 200 mg daily combined with grey hair removal therapy is a commonly prescribed treatment and has given better results. Antioxidant rich shampoos are available in the market, but their efficacy has been questioned due to their short contact period. Green tea extract, selenium, copper, phytoestrogens, melatonin, and recombinant human growth hormone are attractive anti-graying substances under research and development. Anti-aging mitochondria targeted antioxidant plastoquinone SKQ is shown to slow down senescence and age-related changes such as hair graying, baldness, retina problems, cataracts, etc. are also under development. Research on liposomal delivery of melanin into hair follicles may prove successful to darken gray hairs in the near future. Delivery of drugs through hair follicular route is an interesting novel concept. Current research focuses on topical liposome targeting for melanin, genes, and proteins in hair follicles. Liposomal delivery of melanin into hair follicles has resulted in darkening of hair follicles in experimental settings. Common queries and myths. Here we shall present common queries in the form of question and answers. Firstly, can you prevent graying of hair? The answer is no. There is no way to prevent hair from turning grey with aging. Eating a healthy, well balanced diet is a good measure. This improves your overall health and decreases the risk of developing any nutritional deficiencies that may be associated with premature graying. Lifestyle changes like smoking cessation and lowering the stress levels could help prevent premature graying. Although so far there is no definite evidence to say this, but research shows that these two lifestyle changes may be worth adopting anyway. Next is, can grey hair be reversed? Until now the answer is no. It is a fact that once a hair follicle stops making melanin, it isn't possible for it to regain its color on its own. Next, are there any for sure grey hair treatments? So far, there are no such treatments available that could treat or reverse graying of hair for sure. Ongoing research may bring effective medications and treatments for grey hair. But for now, the best choice is to use hair coloring, which is mostly temporary. Another question is, are there natural remedies that slow hair graying? So far, there are no natural remedies that could halt hair graying. At the best, you can stay healthy, eat a well nourished diet, and lower your stress levels and hope for improvement. There are many other myths about grey hair that you may have heard. Here are some common ones that are not actually true. Coloring of hair leads to loss of hair. This is not true. Plucking grey hairs leads to many more grey hairs growing back. Also is not true. Laser hair removal halts graying of hairs is also not true. Bleaching hairs causes grey hair is also false. A summary of the whole topic may be as follows. A rule states that by the age of 50 years, 50% of the population would have 50% of their hairs turned grey. Graying hair with advancing age is a part of the normal aging process. Graying hair at a young age can be caused by vitamin B12 deficiency, smoking, genetic factors, stress, and certain medical conditions. Certain health conditions and daily life habits may contribute to getting gray hairs early or premature graying of body hair. The age at which graying starts is mostly determined by your genetic factors, mental health, certain diseases, heredity, lifestyle, and medication. So, if your parents' hair went grey early, then it's likely that you may too. It's not possible to reverse or treat grey hair at present, but with advancing research, many options will open up in the future. Consulting a skin specialist can help you identify your underlying causes for grey hair at a young age and suggest a remedy. Thank you.